Well, here at the annual meeting, we just presented a paper from our work at Erevan. The lead investigator is Dr. Erevan Haripriya, and she presented the paper. And this was a 6-year retrospective study that involved more than 1,540,000 consecutive cases of cataract surgery. Half of them had intracameral moxifloxacin, and that drug lowered the infection rate from 7 per 10,000 to 2 per 10,000. We also looked at the fact that posterior capsule rupture raised the rate very high. It jumps up to 44 per 10,000. If you then have, that's without intracameral moxifloxacin, with the antibiotic, it's down to 19 per 10,000. So it argues for the use, if someone isn't using intracameral antibiotic routinely, to at least do it in a high-risk case like posterior capsule rupture. The other thing that's kind of interesting is you can now, we teased out and separated posterior capsule rupture because that's such a risk factor for endophthalmitis. And let's just look at routine phaco with no posterior capsule rupture. It turns out then that the rate, if you use intraocular or intracameral moxifloxacin, is only 0.6 per 10,000, which is 6 per 100,000. If you take routine uncomplicated phaco, otherwise you're up to maybe 5 or 6 per 10,000. And what are we doing in the United States? The rate is actually about 7 per 10,000. That's data from the AAO registry. Of course, many of those cases didn't get intraocular antibiotics. It includes posterior capsule rupture in high-risk cases as well. Well, climate change is on everybody's mind, particularly because in the past month the United Nations came out with their dire predictions. It turns out that the healthcare sector is responsible for about 10% of the carbon emissions in the United States. And there's some really excellent work done by Rangaraj Venkatesh at Erevan, along with Cassie Teal, who's at NYU. And they've shown that at Erevan, because they reuse things, their carbon footprint for a phaco case is about 5% of what ours is in the United States. So we are required to not use anything that's labeled for single use a second time. It's very heavily regulated. Contrast that with at Erevan, where they reuse their gowns, their gloves, they reuse the phaco tubing, cannulas, phaco tips, and they also have multiple patients at the same time being operated on in the same R. These are all things that wouldn't be allowed in the United States, for example. And then you go back to what I said, their infection rate, because of intracameral moxifloxacin, is 6 per 100,000 when you look at uncomplicated phaco. So if they were now required to do what I have to do in California, we would multiply their carbon emissions or their carbon footprint by 20-fold. We'd probably multiply the cost by more than 20-fold. And to do what? Try to get 6 per 100,000 down to a smaller number. So it does point to the fact that so much of what we do is not only wasteful, it may be unnecessary. And so many of the regulations that we are really having to comply with in the United States and in Western Europe are really not evidence-based.